Hello and welcome to Facebook Live here at CGH Medical Center. I'm Bill Bird and I'm the Chief Medical Officer here at CGH. And thank you for taking the time to listen in. So let me give you a preview of today's broadcast. First of all, I'm going to basically give good news about COVID and the pandemic here at the beginning of this broadcast and give you some facts that I think you'll be encouraged by. And then, as always, as I'm talking, feel free to send your questions my way. Then once I'm done with that, actually, in lieu of having a guest with me today, I did a field trip yesterday at our pediatric rehabilitation facility, which is just north of the hospital, across from, I don't know if it's still called the Red Apple, but up in that area north in Sterling, and spent some time talking with the staff there and also showing you some of the new equipment that we have there in the pediatric rehab center. I think you'll find it really interesting. We actually had an open house for pediatric rehab right at the start, like right before all the lockdown happened for the pandemic. So a lot of folks really didn't get a chance to see what we have out there, and it's really interesting and really for this area, such a great thing to have available for children and their families. So when I get done with what I'm talking about, that's what I'm gonna go. We'll go right to that. Secondly, I just wanted to highlight that next week that my guest is going to be Dr. Eric Coons. I've had Dr. Coons on here a couple other times, and he's really knowledgeable. He's the chairman of our Department of Internal Medicine here at the hospital, and also the leader of our COVID clinical task guidance team. So looking forward to have Dr. Coons next week, and definitely I'll have some questions for him, and I would be ready and ask some questions of him when he comes on next week as well. So that's setting up this week and next week. Let me go into just a few items that I wanted to talk about related to COVID, which I think by and large are very positive. So first of all, the Johnson & Johnson vaccine. Looks like tomorrow is going to be the official thumbs up, and we're ready to go on that vaccine from what I'm hearing. 72% effectiveness of that vaccine here in the US and 64% in South Africa, where there's that variant that is out and about. But even with that variant, it's 64% effective. And remember, we're talking like you don't get sick at all effective. If you look at the severe disease in those in both in the U.S. with the Johnson & Johnson vaccine, it's 86% effective in preventing severe disease, and even in South Africa, it's 82% effective in preventing severe disease, which is really good. That's like that lowers COVID to more of a flu-like illness in terms of the amount of people that get really sick. So that's a really good thing, even with Johnson & Johnson's vaccine. What else did I want to say? Here at CGH, another piece of positive information. I think it's about 1,100 employees that have been fully vaccinated here. Of those employees, so far at least, none of them have had a symptomatic case of COVID. So that is really good. We've also, the employees who haven't been vaccinated, we continue to have a smattering of them who continue to get sick and have symptoms. So it's just very clear that the vaccine's been very helpful. In terms of where we're at, I was talking to Cindy Zander. She was my guest last week, and updated information on next week for vaccines here at the hospital. So we're planning on doing 170 first-time vaccines for patients next week, and 892 people will be getting their second dose of vaccine here at the hospital next week. So pretty busy week. In terms of Illinois vaccinations, 2,310,929 as of yesterday. I think there's 11 million people or so that live in the state, so we're starting to make some progress there. Today, I know the White House is having a celebration for their 50 millionth vaccine being given today. That's really good. Good news. If you're listening, you haven't had a vaccine yet, you're like, okay, yeah, but how about me? So, how about you? So, what I'm hearing and what I'm reading is that between Johnson and Johnson, Pfizer, and Moderna, they are expecting to have 130 million vaccines. What did it say here? Shipped out by the end of March. So that's half of U.S. adults. That's a good chunk of people, and I think it's just going to keep rolling from there. So that's really encouraging that half of our U.S. adults will at least get a vaccine in this next month, and then hopefully the following month will almost everybody else will have to see how that all rollout goes. In terms of CGH, in terms of our results from COVID, we've tested 19,651 patients since the pandemic began. Of those, 3,325 have been positive, and 16,269 have been negative. That's going to put up some Whiteside County data for this week. So if you look at that, we have in the county 3.6% rolling positive rate versus 2.8% in the rest of the state. And then that top right number is 146 total deaths from COVID, which is obviously 146 higher than I'd like to see it. But it has tapered off and not been as rapid of a upswing on that number. And then you look at that graph at the bottom there, and you'll see that the mid-November-ish peak of cases, and now where we're at in terms of the number of cases that we're seeing here in the county. So that continues to be encouraging. I ran across something else that I thought you would like to know about. So the CDC has backed a website, and we'll post it on our website so you can have access to it. But it's called the website's called vaccinefinder.org. Vaccinefinder.org. And it sounds like it's a website that is trying to take all the vaccine sites across the country and putting those all together in one spot. So you could, I haven't gone to the website myself, but my guess is you probably would type in where you live, your zip code, something like that, and then you're going to get some information about vaccine opportunities around you. I don't know how robust it is here. Oh, thanks, Matt. I don't know how robust it is around here for this rural area right now, but my guess is it's going to ramp up too and give us a lot of good information for those who are trying to kind of figure out where can I go to, how far am I willing to go to get a vaccine. Understanding, of course, that in the next month or so, I really think they're going to start rolling out, and we're going to have much better access, even here in this area in our community and communities. But I wanted you to be aware of that. Long-term care facilities, the number of cases is down 80%, which is really, really good news in terms of those folks who, when they get sick, they get really sick, and have a much higher rate of death with COVID, obviously. And speaking of which, deaths are down 65% in nursing facilities. So all really good news. I think that all goes along with the vaccines being given first in nursing facilities. So it speaks to the vaccines and the vaccine's effectiveness. I wanted to give a little perspective from my perspective on COVID and this pandemic compared to your typical flu season. So between just 2011 and 2020, in a typical flu season, you have somewhere between 12 and 61,000 people that die from influenza. So, as you look at the graphs, most of those fall around. My guess is we're probably talking an average of around 20 to 30,000 on a typical flu year. So, and then you put that in perspective with COVID, and obviously right now we're at over, I think, 501,000 as of the 23rd of February and counting. So we're going to top out, obviously, much, much higher than your typical flu season, which is why this is such a serious disease, why it's so important that we follow the guidelines that we're asking from a public health standpoint for folks to continue following because it's a way, way bigger deal than flu in terms of the number of people that are dying from COVID. Yeah, so let's say 25 to 30,000 from a typical flu season, and we're, as I said, 501,000 for COVID so far, and we are showing a tapering, but it's obviously it's still going. So I think though, what's encouraging to me though is to think that COVID probably is not going to disappear anytime soon, but I think what we're going to see, and I'm reading this, is it's going to become more and more manageable to the point where you get to where your typical flu season numbers are at, which we've managed that. People go about and live their lives during the middle of the flu season, and that's very doable. And I'm co- I'm I'm feeling very much and more confident that that's the direction we're headed. Obviously, these variants have some bearing on that, but I'm feeling more and more comfortable every week that goes by about where we're headed. So, and when we talk about that, I wanted to, speaking of being more manageable and kind of getting to a flu type of typical flu season in terms of how many people are affected by COVID. Israel is a good example of this. They vaccinated 602,000 of their citizens, and of those 602,000 that were vaccinated, and they've been following. 21 of those were people were hospitalized. So it's about 3.5 per 100,000 people are hospitalized. So to give you some perspective, in a typical flu season, there would be 150 per 100,000 people who are hospitalized. So these vaccines are on pace to bring life to some normalcy, and it might be that we find that COVID is in some ways more manageable. We'll see. At least the vaccines are making COVID more manageable and much more like a flu season rather than this pandemic that we're seeing right now. So obviously variants have some bearing on that. But as I was mentioning earlier, even with the Johnson and Johnson product, it in terms of severe disease, which severe disease is basically defined as you need to have oxygen, you need to be in the hospital, and or sicker than that. So even the Johnson and Johnson vaccine is doing a nice job on the variants in South Africa. So I'm cautiously optimistic about all this stuff that I'm sharing with you today. So that is, oh, okay. Is there a difference between COVID vaccine shot number 1 and shot number 2? And also, will there be a booster shot to address the variant strains? So, first question, not a difference in terms of what the shot has in it. No, it's the same product in both shots. It's just that your immune system has been obviously stimulated by the first vaccine, and then the second one boosted even further. But no, it's the same product in both shots. And booster shot, I think there likely will be a booster shot at some point in time. I'm reading that is definitely something that companies are moving towards. It sounds like this mRNA product, which is the Pfizer and Moderna, at least, they're able to flex to adjusting their shots fairly easily. So I wouldn't be surprised if we see that, and it may. I'm not an expert on all this, but it may end up being something like you would see with the flu shots every year, where the when you get a flu shot, you get, I think it's three different. They guess on, educated guess, mind you, but they're guessing on what they think the prevalent strains are going to be that season, and then you get a shot based upon that. And I would not be surprised if that's how COVID ends up being, where it's a booster shot based upon the strains that are out and about in the world at that time, or projected to be out and about in the world at that time, and even whether or not that gets rolled into a flu vaccine could be the case as well. Oh, here we go. Question ties the previous question as, are we far enough out from the development of the vaccines to know the longevity of efficacy, or still learning as we go process? Yeah, still learning as we go. Encouraging so far. I'm not hearing anything from the folks that were part of those original studies that Pfizer and Moderna did, whose immunity has won't begun to wear off. And gosh, I think you're talking September or so that they received those vaccines. But no, I don't think we're far enough along in terms of knowing how much immunity we have for how long. We do know for people who have acquired COVID and naturally have gotten sick without a vaccine, that now we're talking. It looks like 6 months, which is encouraging, and I've read an article this week that for people who have already had COVID, it's still pretty hard for them to get a second round of it so far. And I'm not sure how far back that goes, but it looks like that infection and or the vaccine is going to be pretty helpful in terms of getting sick again. And if you do get sick again, not getting a severe disease. So far promising. Ah, okay. Is CGH expanding their waiting list to include these individuals? Yes, we are. I think though, I'm not sure the date when that is happening. And one thing to keep in mind is right now, yeah, we will. First of all, to answer your question, yes. Not sure how soon it's going to be. It's going to be fairly soon. I was hearing some folks talking about that. I will say though, at least as of earlier this week, I think we had around 6,000 folks that were still that were on the waiting list that were still in the 65 plus bucket. And I shared earlier here in the broadcast how many shots we were giving next week. So we still have some catching up to do to get the 65 plus crowd taken care of. I do think that, as I was mentioning, as this month rolls on, I'm really hopeful we're going to start to see some much bigger distributions to us, and I think the rest health department hopefully will have more to give out and others. So hopefully that'll begin to wind up really quick. But right now we still have a pretty significant 65 plus waiting list. But rest assured, we will have a under 65 chronic conditions that want the next phase waiting list that will get going on in the near future. Okay, so just tune in. When are 76-year-olds going to be able to get their shots at CGH? Uh, they are. They are getting their shots. I think right now we're working on. Last I talked to Cindy Zander, we're on that 60. We're on that 75 to 85 or 74 to 85, somewhere in that age range. We are doing that part of the waiting list. So if you haven't had a call yet, it's just because there's a bunch of folks on the waiting list. As I was just saying, last I heard there were about 6,000 people on a 65 plus waiting list, of which I think there were only 60 or 70 86-year-old plus people on it. So there's a lot of folks between 65 and 85 on that list. So you should be getting a call from us at some point in time here in fairly soon. And or remember the website, look on the health department's website. And as I mentioned, this vaccinefinder.org, it may have some options for you as well, not just in our area, but if you wanted to expand your search a little bit. So yes, that's what I know. Other questions from the folks who are listening in? Going once, going twice. Okay, so thank you for listening to my part of the broadcast today. I'm really looking forward, very excited about showing you this field trip to our pediatric rehab facility. They do some great work. They have some great stuff in there that people just don't realize when they're driving by that facility. How cool that stuff that they have out there, and the people that do great work with our children. So, without further ado, thank you for listening to my part of the broadcast, and we're going to move on to our field trip at our pediatric rehabilitation facility. This is welcome to the field trip for today's Facebook Live. I have Jeff Wright with me here. Hi, Jeff.
Hi, how are you?
Doing good. Jeff is the director of outpatient rehab here at our hospital, and today we thought it would be fun to show you some new stuff. We have fairly new stuff that we have here at our pediatric rehab area.
Yep.
There's our sign for pediatric rehab. And so what we're going to do is we're going to kind of walk you through this area and give you some highlights. When did we open this up, Jeff?
It'll be 2 years in May.
Are you kidding me?
Yeah, 2 years already. So,
all right.
Building's grown a lot, staff have grown a lot. We've added some specialty services that we'll highlight today.
Yeah.
And show the facility off a little bit.
Yeah, and the three big folks that we have here are, can you kind of say OT, PT, and speech?
Yep. Pediatric OT, pediatric PT, and pediatric speech therapy.
Yeah. So we're gonna talk to all those folks and kind of some of the equipment that they use to do their jobs. So here we go. Okay, so now back to us. And so Jeff, what do we have right here just in this particular space?
So this space in general is kind of our gross motor gym. So in this area, obviously you can see there's rock wall, climbing things, a trampoline in the corner. We also have a swing right here to the side of Dr. Bird.
Oh, yeah.
So in this area, PT, OT, and speech can use it as part of their treatment area. So if you think about traditional rehab for the adult population, we have machines and equipment, modalities.
Yeah.
In the pediatric setting, this is kind of their equipment arena to work with. So we can highlight a little bit of the equipment we have specifically that's unique to our location, and talk to some of those providers too.
Yeah, good. Yeah, I mean, it wouldn't make sense to have a universal machine for a 4-year-old.
Nope. Kids like to run, jump, and play. And
is that how that works?
Yeah, skip and hop.
And
so we need room for that, and we need fun kids things for that too.
You bet. Okay, good. All right. So I think what we're going to do from here is we're going to kind of make our way over to another area, and I want you to introduce me to some of your folks. Okay, Jeff?
Okay, sounds
all right,
good.
Here we go. Okay, so we're in another area here of Peds Rehab, and I have with me Becky Voss. Hi, Becky.
Hello.
So Jeff, Becky's one of the folks that's been with us for a while.
Yes, coming just past 2 years.
Okay.
Yep. So Becky is one of our pediatric physical therapists out here, and then Shauna in the background here is also one of our pediatric PTs.
Okay.
And they'll do a little bit of a demonstration and kind of show some of the unique stuff we have.
Yeah, good. Thanks, Jeff. So Becky, before we get to our captive audience over here in Shauna, what kind of kiddos are the folks that you're going to be seeing? They're going to be using this cage here.
So this cage is originally designed for cerebral palsy kiddos.
Okay.
But we use kids in here, all diagnoses. As you know, Shauna, like with any delay with crawling, we can get them crawling in here, walking delays, anything really that you can put your mind to, the kids can get in here. You can do adults in here too, as you can see, straight with Shauna.
Yeah, right. So large motor mainly?
Yes, a lot of gross
muscles.
motor.
Yeah.
Yep, and Katrina can talk to it too, like with our sensory kiddos, like if they need a lot of deep input, they'll come in here and they'll do a lot of jumping, a lot of running back and forth and using the resistance to be able to help them with that.
Yeah, okay, good. Well, let's go over here and find Shauna along with Becky here. So, hi, Shauna.
Hi.
This is probably, you just do this for lunch break, probably.
Oh, yeah.
All right, so between you and Becky, kind of tell me how this whole situation works.
Yeah, so right now we have it set up with assist, so it'll help provide some support if the child goes down. And then it's also set up for resistance as well, so it makes jumping harder.
Okay.
This you only put on them if they can stand, but it's good for working in any direction.
Okay. Yeah, because how did you guys do help working with a kid who had some motor issues before you had this?
We killed their backs.
Okay.
No, but really we have a gait trainer system that would walk with the kids, and we would use that. Otherwise we sit on stools and we use our legs, our arms, our shoulders, we use anything and everything that we could. So this has been, we get 8 extra hands, whereas we didn't have that before.
Yeah.
So it's awesome.
Yeah. What does it help you to be able to do? So you're not having to use your hands just to hold the child up.
Yeah.
What are you then able to do a better job of when you have this?
Yeah, so now we can actually facilitate their alignment, specifically hold their leg or whatever we're trying to get better alignment. So when they do, a single leg squat, they're doing it in better alignment.
Yeah. How long does it take if you have a child that's kind of working on this? I know that's a very broad question, but how long does it take for a child who's using this piece of equipment to where you start to say, man, that's making a difference for them?
So I had a kiddo that when we worked with, we were starting to walk. And we had, I think, 3 weeks in here. We used the tracking system, so we suspended him.
Okay.
And after 3 weeks, she started independently walking. So
Okay.
for her experience, it was really quick.
Yeah.
Sometimes it can be longer, but I
Yeah.
don't know
Yeah.
if Shauna has any.
Okay. I just heard hanging suspension. I'm
Yes.
wondering what we can do here with Shauna as far. What are we talking about?
So this is a tracking system.
Okay.
So it would be a different type of hookup.
Like
So we
these
use
cords
these straps.
So you pull this thing back here and it kind of pulls the folks along?
Yes. Yep. And so they are able, so we can have the kiddo all the way down to the floor and then they just walk with the system.
Oh, wow. Okay.
And so again, we
Yeah.
can be totally hands off and we can help them, their little legs going
Okay.
rather than us
Yeah.
holding their body upright and working with their legs.
You can also
Fine.
put them in this on their belly too, and then we have all these different hookups. So I'll have some where they're on their belly on this track, and
Yeah.
we'll do some upper body with the pulleys pulling
Yeah.
back and forth, or
Okay.
just swinging side to side to get some core in it too.
Yeah. Yeah.
And the kids find it fun, so you're getting
Yeah.
exercise and entertaining them.
Yeah. You bet. I'm sure that was really a big hit for the kids. What are those like 1, 2, 3, 4, 5 things back behind you for?
So those are weights. So another way you can use this, we have a table here that we use, and we have pulleys. So you can actually like suspend their leg in the air and use the pulleys to isolate the
So they
specific
have to kind
muscle.
of pull the leg down
Yeah,
or up
yeah.
or whatever you want to do.
Yeah, exactly. And then they don't have to focus on holding their leg up. They're just focused on that specific muscle you're trying to strengthen.
Yeah. That's very slick. Okay, so Shauna, I'm going to leave you. I trust that you're going to be able to get out of this.
Yeah, I'll be good.
Okay. And while she's doing that, I wanted to key in on something that our viewers may not have. It's on the floor here. So,
Yeah.
Liz, I'll let you show kind of the floor and show that machine. And then while you're doing that, Becky's going to kind of talk about what this is all about.
Yeah, so this is our interactive floor cube. So this is just another way that kids are able to engage with the exercises that we want them to do. So I think there's about 15 different games that we're able to do with the kiddos.
Okay.
There's soccer, there's pool, there's like an underwater experience where you go in and the water splashes with the kids and the
Yeah.
fish move. So you can see it's collaborated. Oh, not all the way over here though.
Yeah.
To be able to move. So as you
Yeah,
go
I'm
through,
follow you.
yeah.
Oh, wow.
So they move. So like if we want to work on kicking with the kid,
Yeah.
let's say we're just
Yeah.
never over the ball.
Yeah.
Like you can come here and have them work on kicking, or
Oh,
you can
wow.
work on jumping and having them try to
Let me see.
explode the
Yeah,
candy.
yeah. Oh, nice.
So then all of the candy just exploding all over the place. So just keeping them more engaged.
Oh my gosh, yes, I'm
Yes.
sure that would be. Jeff, you could use that for the adults, maybe.
Definitely, yeah.
Absolutely.
Well, that's
So-
pretty cool stuff.
Yeah, so there's, like I said, there's a bunch of different games that kids are able to use here. So we absolutely love it.
Yeah, yeah, great stuff. Shauna, who's still getting on hook. And Becky, hey, thanks so much. Appreciate the
Thanks
work
for
that you
coming.
do, and it's really cool to see some of this stuff that we have in play to help these kids out that we didn't have a couple years ago.
No, we
Yeah.
just got this about a year ago.
Yeah,
so.
yeah. So good stuff, and thank you very much.
Thank you.
Thank you very
Yes,
much.
thank you.
Okay, so here we are continuing to be on our field trip in pediatric rehab. And Jeff, you have another friend you want to introduce to us.
Yes. This is Erica Smith, one of our speech language pathologists here at CGH, specifically on the pediatric rehab side. And Erica has a couple, can explain a little bit more about speech therapy in general, and also feeding therapy, which falls under the realm of speech therapy.
Great. Hi, Erica.
Hi,
Long time no see.
I know.
All right, so I'd like to have us go into one of your rooms that you work. What kind of rooms? What's this called?
This is our feeding therapy room.
Okay, all right. Did you have anything equivalent to this before we started this rehab center?
Definitely not, no.
Okay, all right. So this is new and improved as well. Actually, just new. We didn't have improved. We didn't have it. So here we go. Erica's going to kind of take us in here. Come on in, everybody.
Yeah.
All right. So tell me to kind of walk us around and kind of
Yeah.
point out the stuff that we need to know about
Definitely.
it, Erica.
So most importantly, we do have chairs for the child's caregivers, as they are a very important part in the therapy, as
Sure.
they need to be present here so that they can carry over our strategies at home.
Right.
You will also see we have a variety of different chairs for the child to be in while we're presenting different foods. So we have high chairs for our infants. We have, we call them, they're kikaroo chairs. So
Okay.
we have different inserts we can put in so that they are more stable.
Okay.
And we also even have a chair that can clip onto the onto a table. So if they're more comfortable sitting right next to mom, we can do that as well.
Okay. So some of that stuff up in there is that what you're
Yes,
talking about?
yeah, the different inserts for different ages and
Okay.
all that good stuff.
Okay. So what would be the it's probably not typical, but what are some patient types that get referred to you that you take care of here with swallowing, speech,
Yeah.
feeding related issues?
So we definitely see a variety, anywhere from infants that have just been discharged from the NICU and are just learning how to eat, to children that have been tooth fed their entire life and are learning to accept foods orally, to just our run-of-the-mill, more picky eaters that, they eat everything by mouth, but maybe they are just really selective and it's really causing a lot of stress and anxiety for both the child and their family during meal times.
That is interesting. So tell me, how would you go at it? I'm sure there's some folks out here who know people in their families that are picky eaters.
Mm-hmm.
What are some tips for picky eaters and how do you work with them?
So really, the most important thing is to get some of that anxiety out of the meal. So it's kind of reverse psychology. So we really want to take the pressure off and make it fun. So we do play-based approaches across the board for speech therapy, but we also do it for food. So making food not be so scary anymore, making it fun. We play with our food a lot, actually, and just take a lot of the stress out of it. And that really helps the kids become less scared of it and accept a lot more varieties.
When you say play with it, what do you, like kind of thing, or more like just, what does it look like on one of these things when a kid's appropriately playing with food?
Definitely. So maybe we have a pea, but we don't call it that. That would cause a meltdown. But maybe it can be a ball and we can use our fingers to kick the ball. Mm-hmm. Yes.
Okay.
Yes. Mm-hmm.
All right. So you take a pea and call it the ball and let them kind of pretend like they're playing with the ball.
Yes.
And the ball eventually ends up in their mouth.
Exactly.
I should have thought of that one with my kids. So, okay, well, if I have grandkids, I guess I'll know that.
There you go.
Okay. What other situations come here and you have that you take care of in a spot like this?
Are you talking more feeding therapy wise or speech therapy?
Speech. Let's talk speech a little bit. Is speech in here, or is that going to be in the other room?
But lots of times we're going to be in the other room.
Individual rooms.
Yes.
Okay.
Yes.
Okay. So we don't actually have to go to the individual room for you to kind of tell me what would you do in a typical, if there is a typical therapy session for a kid who's, like when I was a kid, I had a hard time in my R's and my, I think S's, something like that, or I don't know. What's the plan when you have those young children in there?
So once again, we have the parents involved in the majority of our sessions so that they are aware of what we are working on, they are aware of the techniques we are using, and they can be practicing those same skills at home, because we know that 30 minutes or an hour of therapy a week is not going to create the progress that we want for long-lasting skill development. So we want the parent in there learning all of the techniques. But lots of times we are seated at a table, just like this one right over here.
Okay.
It's
child appropriate. Do you get down there
Yeah, we have those rolly stools and we can adjust them so we're at their level. That's important too, so we can really be seen. Exactly.
Yeah.
And so we always, even if we're doing drill work, so we might have our cards out that have our target sounds on them. We also want to have fun, motivating activities for them too. So we have a variety of toys here at the clinic at our disposal that we might do 20 cards and then we take a couple minutes to play, give them a little brain break, and then we go back to it. For our really young ones, we're going to incorporate it all during play. So we might be, getting all of our target sounds by selecting toys that contain those target sounds. So we're still getting those targets in, but the child might not even know that they're actively working on those skills.
Like a pea being a ball.
Exactly. We're masters of disguise around here.
What's the age that what's the youngest age that you start working with kids, Erica?
For speech therapy, I would say 18 months is probably about the earliest that we start getting referrals at. But for feeding therapy, it could be as soon as they are discharged from the hospital. So.
Okay. And for the families who are out there that are listening to us, and I'm sure they're, maybe they may know people in their lives young kiddos that have some speech issues. When would like an 18-month-old, just in general, you'd say they probably need to come see you?
Yes.
What are we looking for?
So at 18 months, we want to see a minimum of 10 words. If an 18-month-old does not have at least 10 words that they are using consistently and meaningfully, then we probably want to see them in for an evaluation.
Okay, 10 words at 18 months.
Yes.
Is there another benchmark at another age? What would that
Definitely
be?
50 words at 24 months, and we want them to be using 2-word combinations.
2-word double at how old?
At 24 months.
So at 2 years of age, to be able to put no mama or whatever.
Yeah,
Put
exactly.
two words together.
Mm-hmm.
Okay.
Yeah.
That's a good guideline to go by. Yeah. Okay.
Yes.
Good. Hey, Erica, it's been a pleasure. I know you have a patient to get to right now, so I don't want to keep you from that. But thank you so much for your time and kind of sharing some of your knowledge with the folks who are watching here.
Thank you very much.
Okay, so now we are in what's called the sensory room.
Yep.
Jeff, first of all, I want you to introduce someone for us here.
This is Katrina Alexander, one of our occupational therapists here at CGH Medical Center. Katrina specializes in the pediatric population specifically. And she also has an occupational therapy assistant. Her name is Whitney. So Whitney and Katrina kind of work in a 2-person team to take care of kids with sensory issues, but any fine motor or occupational therapy related impairments. So
Great.
Yeah.
Hi, Katrina.
Hello.
So I think before we really give folks the real full understanding of what the sensory room is, when we knock the lights down, I want to ask you a few questions.
Okay.
First of all, an occupational therapist may be something that folks are a little bit fuzzy about what exactly it is that your role is in trying to help young kids out. Can you kind of, in a nutshell, talk about what you would see your role as with these young children?
Right. Yes, we can. When I think a lot of times families hear occupation and they think of jobs, right? Job performance. But in children, their occupation is play.
Yeah.
So we are helping families and their children meet those developmental needs and skills that they're working on at different times and different stages when they're a child. So,
Okay.
and that may include fine motor skills, coordination, as Jeff mentioned earlier, and sometimes it includes self-regulation, sensory processing issues.
Sensory processing. So what would a sensory processing issue be? Code for? What kind of kid are we talking about here?
Okay, so first of all, I'll kind of give you a little information about our sensory systems. And those include our somatosensory, which includes touch or tactile, proprioceptive, the input that we get throughout our body and our joints.
So as we move around.
As we move around,
Okay.
the feedback that we get from our body.
Okay.
And that also really, in point, tells us how to move. Once we
Okay.
get that feedback, we need it as we're developing as children to figure out our body and space.
Yeah.
That also includes vestibular, which is highly important. Again, that helps us determine how we push up off the floor, how we position our body when we're sitting.
So vestibular, I think of as more of a balance kind of thing?
It is.
Okay.
It is.
All
And
right.
also auditory, an auditory system.
Okay.
So sometimes as we're developing, we need a little bit more help in maybe integrating those sensory systems with our body.
Okay.
And they really impact the way we focus, executive function, the way we organize, the way
Yeah.
we interact, our social emotional aspects, and
Yeah.
as well as movements, which we just mentioned before.
Yeah. So that would fall in the category of as we're moving around, we have a certain way that we typically experience the world in doing that. And when that's not quite the same,
Right. That's exactly it.
it comes out.
Comes out a little bit, we might have a sense of loss of balance. We may
Okay.
take us longer to figure out how to push up into crawling.
Okay.
Sometimes it's even dressing, figuring out how to position our body when we go to put on a coat or button
Okay.
or tie our shoes.
Yeah. Yeah. So that sounds like definitely some of these children that you're seeing are kids that are on the autistic spectrum, if you will.
Yes, that is, a term. They can fall on the spectrum. And also sensory processing disorder is a separate diagnosis from as being diagnosed as being on the spectrum.
So help me understand the difference between those two. Or for the folks who are listening that, would be curious about that.
So there is some, that has come into light in the last few years. They've recently distinguished that, and the diagnostic manual psychological disorders. So sensory processing disorder, these children present as, like we said, maybe they're just having a little trouble with certain textures in their clothes, a little trouble with eating textures, trying new foods, self-limiting, sometimes sleeping. When we play into the social emotional, like reading others' emotions, then that would, when we going through the checklist, that would maybe move into a diagnosis of being on the spectrum.
Whereas the folks who have the sensory proprioception issues they would still be able to understand the cues that people are having.
Right, reading other social cues and emotional aspects.
Okay, that helps to kind of tease those out a bit. This is an interesting room. And first of all, before I let Katrina kind of give you a little field trip here of this, I also wanted just to say that I'm pretty sure this room was sponsored by the CGH Health Foundation.
Yes, it was. And we are so very thankful. We're lucky to have this in our facility and in our community. Some families travel over an hour sometimes to get sensory integration treatment or a gym of this nature. So
right, yeah. So just a thanks to the CGH Foundation, and for those of you who are viewing who are so inclined, some of the money that you donate to the foundation helps with stuff like this.
Yes.
Yeah. So, well, before we turn the lights out, because the lights turn out part here is pretty cool. But before we do that, show me a few of the bells and whistles that we have in here to help kids out.
All right, to our right over here against the wall.
Very good.
You're going to see our, this is our tactile wall. And we work just a lot of what looks like play, but really it's structured sensory play. So some of our kids have what we call tactile aversions.
Okay.
And we work on remediation and integration. So we might encourage a game or an activity with maybe touching our palms against this kind of material here. And also, also our grass. Down here, just kind of exploring in a manner that is playful and comfortable. We never force a child to touch or interact in a material that they're not comfortable with. So
that's just cool. Sure.
And they love the colors, and of course, really neat. So we work on facial expressions and reading facial expressions in our mirror as well.
Sure. So what is Liz looking at over there?
This is our bubble tower, and we absolutely love this. This can be used for so many different reasons. For visual input, our visual system, for joint attention activities when we work on working a child to gain even general attention and joint attention. So interacting with other therapists and playing with their bubbles. So they really enjoy this. It's probably our favorite, my favorite activity or toy in our room. So
it reminds me a little bit of a lava lamp.
I love those.
Okay. All right. So what are these buttons doing?
These buttons, and right now we're currently ordering our bulbs for. They're used a lot, so our bulbs are on another one. But you can turn it off. You can do color combinations. And it has a key right here for all of our color combinations. And that's really fun for the kids to engage in and figure out and just kind of problem solve.
Okay. All right. Next stop on the magical mystery tour here. What's this right here?
So these are our fiber optic lights, and they just systematically change color. Sometimes they coordinate with our bubble tube. But really, we use these for so many different things: fine motor, pinching, naming colors, matching, engaging in kind of an imaginative play activity. Anything from unicorn tails to colored hair. I mean, we just really integrate these into a lot of play activities, but also calming. We have our kids, maybe when they need a minute to come in here, take a deep breath. A sensory, like a nice break.
Yeah, this is just like a huge beanbag chair, right? Yeah.
It is, and we come in, we just kind of put the lights, and they'll take a minute, and then and have them regulate and get back to our therapy session. So.
All right. Yeah. Nice. I'm thinking, and then what do we have over here on the wall?
So this is just a projector, and of course, it's lots of fun animals. And it's great when we co-treat, for example, with speech. We might work on, okay, what animal are we seeing? What sound do they make? What do you think's next?
Yeah.
So it again works on like memory, short-term memory, executive planning, and sounds, of course, with speech.
Yeah. So how long, when you take kids on, how long do they stay with you during like a typical kiddo who has some sensory proprioceptive type of issues? How long will they stay in your care? How does that play out?
Well, the first thing that we discuss with the family is their goals as a family. And that kind of varies. It really varies on the family's goals, the time frame they want to meet them. Some of our families, maybe who are progressing from, say, childhood into a teen, may need assistance with life care skills, such as getting even ready to graduate from high school and go into job training,
Okay.
or ADLs at home with dressing, eating. So it really depends on the family's needs and their.
Yeah. So it varies in terms of how long those. What's the shortest and what's the longest you might have a child that you'd see for some of these kind of issues?
Some of our families come in and maybe they're just working on a certain developmental skill, for example, using their pinchers to pick up a food for self-feeding, and that may be a couple of visits, maybe over a time frame of 2-3 visits, and we give them a home program. And we really encourage our families to communicate with us and follow through with home programs, because that's where really a lot of the work is done.
Yeah.
For our long-term patients, maybe they're a little bit older clients, over a couple of years, and we really work with those families to help them reach their milestones.
Yeah, very nice, very nice. Okay, so now we're gonna have the big unveiling here. We're gonna show this place when it gets dark. And how often do you do it when it's dark? Do you meet when you?
It depends on our child needs. Like sometimes the lights are overstimulating for our children with visual processing needs, and sometimes we use the lights, we turn them up when they need a little bit more, they need to be woken up, a little bit of movement. So
you just kind of.
Yeah, you just kind of look at each client and child.
Okay, abracadabra. We're gonna have the lights go down here. Oh, here we go. Okay, so Liz, this is pretty cool. We're at the lava lamp.
Yeah, this is a favorite. We just need to sit over here and take a minute, and we'll talk about where our bubbles go and what colors they are, and
and then the string, what do you call the string?
Our optic lights are.
Yeah, the optic lights look pretty cool. Yeah, I would think that'd be a big hit as well. So very nice. Okay, we'll have the lights go back on. All right, so Katrina, very interesting. I'm guessing you some of these other things that I've chatted with some folks about too.
Some in the gym. Yes, we, as far as occupational therapy, we will work in the gym on also reaching gross motor skills, balance, and the swing that you saw out there is a big part. We work on a lot of vestibular processing activities on the swing.
Okay.
The crash pad that you saw, the big blue square, you guys were out there. So jumping onto that gives proprioceptive input, and it meets our kids, our sensory seekers' needs. They're able to focus and regulate and prepare for a session, and that's when learning really happens, when their body's regulated. So.
Yeah. Katrina, thanks a lot for your time. It's been really interesting just to take a look at this room and hear a little bit more about the work that you do.
Okay, thank you. Thank you as well.
Okay, so we're here in the lobby of our pediatric rehab facility, and I thought was kind of interesting. It's a lobby, and we have some patients in here, so we're not going to do the panoramic of the lobby, but definitely it's very pediatric in terms of how we have it set up.
Mm-hmm. Just the artwork in general, try to make it kid friendly and interactive. And then behind us is actually another gift that was sponsored by the Health Foundation here at CGH. And so it's a giant light bright wall. We have pegs that the kids are able to handle and play with, and create designs or artwork while they're waiting, for their session to start with one of our therapists here.
Yeah.
One of our things that are kind of closed down right now.
Spoiler alert! If you bring your child here, this won't be here until COVID's over with.
Yes, and that's just a safety and cleanliness thing we're working through right now. But traditionally, and up until COVID, this was one of the interactive things in our lobby, just to keep kids occupied and have some carryover between appointments, and then also when they're with their therapist.
Oh, I've got to think this would be a big hit.
Very big hit.
I can remember doing that as a kid. That was a lot of fun doing all that stuff. So great. Well, Jeff, been really interesting to go through the area and see all the different ways that we can help kids out.
Mm-hmm.
Yeah.
Very exciting service line that CGH has brought to our community. Just like to echo thanks to the Health Foundation and those in the community that have supported this kind of mission outreach, providing care to those in our community who didn't have this service line over 2 years ago. So
Yeah.
it's grown a lot, and a special thanks again to the community and the Health Foundation for supporting it.
You bet. Because I don't know, but you have to travel a little ways to find something like this.
Definitely.
Yeah. So, Jeff, thanks a lot
Yeah.
for giving me a tour and showing me some of the team here, and really appreciative of the work that your team does.
Yep.
All right.
Thank you.